Hi everyone, my name is Dr. Michael Wald, otherwise known as the Blood Detective. Welcome to this presentation today, which I've entitled Pain-Free Naturally. So I'm a doctor of chiropractic, and I have been working with chronic pain syndromes and acute pain issues with clients for 33 years. And I can tell you that medicine just doesn't have all the answers. So that's why this is focused on some of the natural methods of reducing pain and enhancing healing. I'm also a board-certified nutritionist with a master's degree in nutrition. I'm also a dietitian and sports nutritionist. I'm a life coach, and I provide acupuncture to my clients, and I even attended medical school, earned my diploma, but I do not have an active license to practice medicine. So let's get into this important topic, pain-free naturally, and I always like to remind you that this is for your education only. This information is not to be considered as a substitute for sound medical, health, or even nutritional advice. But let's get into the basics of various ways that natural medicine can modify pain. And of course, I'm going to be speaking about many different topics and approaches, and of course, these can be used in various combinations, so just keep that in mind. First of all, your diet does usually matter in terms of pain, because if you're eating the typical standard American diet, otherwise known as the SAD diet, standard American diet, you are predisposed to inflammation and also pain, and even increased pain perception on a bad diet. That's been some interesting studies. So you do want to look at your diet, and one way to reduce the amount of inflammatory mediators in you is to consume fewer of them. So meat, for example, is a bit on the fence, because it is, of course, made of protein, and proteins are broken down to amino acids. We need amino acids for neurotransmitters. We need protein for our lean body mass, our organ mass. These are very, very important things. However, you may want to get your protein from another source if you have chronic pain syndromes from any cause, because meat has one of the most inflammatory acids there are in our diets, known as arachidonic acid. And it influences some people to extreme levels and others not at all. So just keep that in mind in terms of meat consumption. It's not an always in or always out sort of thing. So anti-inflammatory foods might consist of foods like those like olive oil, which is an omega-9 fatty acid, very highly anti-inflammatory. Also, the monounsaturated fats you'll find in avocados, also great for inflammation. The same thing with raw nuts and seeds. They have some omega-3 fatty acids in there, which are anti-inflammatory, as does fish, very rich in omega-3 fatty acids. And the omega-3s help to reduce one of the pain molecules known as prostaglandin E3s, which is involved in pain modulation. So high diets rich in omega-3 fatty acids like tuna, mackerel, salmon is a good idea. However, you may also need to take nutritional supplements of omega-3 fatty acids to get in the 6 to maybe 12 gram range, or 6 to 12,000 milligram range, to really affect inflammatory pathways. And also keep in mind that if you are on blood thinners like aspirin or Coumadin, then you may or may not be a candidate for omega-3 fatty acids, which are a very effective blood thinner. So you have to talk to your prescribing doctor about that. And think of the Mediterranean diet, plant-based diet, olives and olive oil, as I mentioned, omega-3 fats again, and grains and fruits and vegetables of various types. The plant-based diet is certainly less inflammatory for most people. And there is, of course, acupuncture. I like this particular explanation of how acupuncture helps pain, because it stimulates peripheral nerves to release endorphins, which are natural painkillers, which modify and modulate pain via the central nervous system. So actually, acupuncture does more than that. It helps release endorphins, enkephalins, and serotonins, and reduce something called substance P, which the higher that is, the more pain is usually perceived by a person. So acupuncture may have its role in pain, certainly. And also, there is the traditional interpretation of acupuncture moving around chi and loosening up blockages and that sort of thing. So you can make up any kind of reason, but acupuncture does seem to help many different types of pain. And then there's some topical treatments, things like arnica. Most of us are aware of arnica for bruising. It helps reduce bruising, but it's also an anti-inflammatory, and capsaicin and CBD oil. So all of these desensitize. That means reduce the hyperactivity of sensory nerves, so it desensitizes the neurons, the nerves of the nervous system, reducing local inflammation and therefore reducing pain transmission. And capsaicin depletes substance P, which I mentioned just a moment ago. The higher substance P, the more pain. So anything that reduces it, that is a good thing. And then there's DMSO. Most of you probably haven't heard of this, but you need to look into this. This is very interesting stuff. So a DMSO, dimethyl sulfoxide, okay? It is a topical cream. That's the form I would suggest. You'll see it on Amazon. Sometimes it's mixed with aloe, which is fine. So DMSO, you should know, is what's known as an iontophoretic agent, which means, that's just a fancy term, iontophoretic, for the fact that DMSO will take practically anything with it into the skin. So you have to clean your skin very well. You put the DMSO on it. And let's say you want to mix magnesium into DMSO because you want to get magnesium into the muscles below the skin. You mix it together. But before you use DMSO in any serious way, you need to take about a quarter's size of DMSO, rub it on an area that you don't mind that might get inflamed or red. So you need to see about 25% of people who do this test fail. That means they cannot use DMSO because it's an allergic reaction. So once you show that you have tolerance to the DMSO, this can be amazing because even without adding anything into it, DMSO is a very potent antioxidant. Also modifies pain pathways. It increases healing of soft tissues and cartilaginous tissues. So it penetrates the skin to deliver anti-inflammatory and pain-killing analgesic effects directly to the tissues by scavenging or collecting and degrading free radicals, which are part of the inflammatory process, thus modifying nerve conduction of pain signals. DMSO reduces local inflammation. It improves blood flow. It inhibits pain signaling transmission, making it very effective for muscle, joint, and nerve-related pain. And it's like $15 for 6 ounces on Amazon, something like that. I've given a disclaimer here because it's sort of in the drug category, so I'm just being a little more cautious. But if you pass that test, it's good to go. And it penetrates very deep, so you want to use this under the guise of a health professional that has expertise in using it, but it can go very deep into the tissue, so it's got a lot of different uses. And then, of course, exercise, different types of exercise depending on what your body can tolerate. And then we start you slow and then build you up. But exercise promotes endorphin, enkephalin, and serotonin release, which are all natural painkillers. And as these are reduced through exercise, they'll reduce muscle stiffness. That's why if you're stiff in the morning, then you walk around and you're feeling better. That's for a number of reasons. We have endorphin release. There's increased in circulation. Muscles start to be more infused with blood and they start to work properly. So moving is, generally speaking, very good. And physical activity resets pain thresholds and improves mobility. And exercise will also improve overall pain tolerance, by the way. I mean, I work out in the gym all the time, and I will have injuries from time to time, and some of them are very painful. And after a while, you know the pain is there, but you just don't react to it. So it does increase pain threshold. And then there is mind-body connection. So various mind-body techniques, meditation, breathing techniques like Wim Hof breathing techniques, or using a spirometer like this. And you can set this for inhalation, exhalation. Use this during your breathing techniques. Or if you want it more calm, don't. But this will really improve your lung function. And but increasing oxygenation and intake of air, which the spirometer will help do, usually helps pain. And people in pain tend to forget to breathe, and that means their carbon dioxide in the blood is not going to be spewed out as effectively. The carbon dioxide becomes carbonic acid. Carbonic acid is inflammatory. It lowers blood pH, increases inflammation, free radical damage, tissue damage. So breathing, very important. And so is, again, various mind-body techniques and meditation. There's many. For me, meditation is listening to thunderstorm and rain sounds. That just immediately gets me relaxed and feeling much, much better. Other people go through a mantra, for example. Others focus on nothing at all. Next, trans-electrical nerve stimulation. don't let me lose you here. This is important. TENS, TENS machine, trans electrical nerve stimulation. You can get this thing for like $30 on Amazon. There are many different models. Don't overpay. You only need the basic kind of thing. Don't buy one of these if it's more than about $60 at the most. So this is great stuff. This is electrical therapy. So you have pain, let's say, on your spine, and there's muscle spasms. So a trained person would put the 4 electrodes that most TENS machines have properly around the painful area, and then you turn up the electrical current specific to the directions that you'll find in the little book that's contained with practically every TENS machine that you can buy. And what you'll start to find is that first you'll increase the current, and then you'll feel the electrical current like a bunch of pins and needles, and it's going to grow in your perception, and it kind of drowns out a lot of the pain. It also goes to the central nervous system and releases those endorphins and enkephalins and serotonins, which is great for pain relief, and it goes there fast, and along with the other pain problem you were having. When you mix them together, the TENS can sort of intermix and dilute the pain signals for pain. But when you put the TENS machine on, what you'll find is you'll have it on a certain setting, and you'll wait 10 minutes, and it'll feel like it's much, much less. So you're supposed to turn it up even more, little by little. Then you wait another 10 or 15 minutes. If you're feeling that, oh yeah, that I'm used to this current, so you increase it again until you cannot increase it anymore. The fact that you're able to increase it is proof that endorphins and enkephalins and serotonins are being released in higher and higher and higher amounts. And the TENS machine teaches your central nervous system and your spine to release these natural painkillers much more effectively, even when you're not using the TENS machine. So much more we can say about TENS machines, but cheap way to get pain relief. If you have a pacemaker or any other contraindication for using a TENS machine, please don't do it. Next, supplements, nutritional supplements. Now, different people respond to different things. I've just picked out a couple of common ones here that you should think about depending on your pain. Curcumin, for example, is extremely anti-inflammatory. It helps to modify a variety of different inflammatory mediators. You want to get that somewhere between 4 and 12 grams per day. Yeah. If it's cancer pain, for example, you might have to have it much higher in the 10 or 12 gram range. Plus, there are anti-cancer effects of curcumin in that range as well. And then there's magnesium. It does have some antispasmodic effects, which can reduce pain. And of course, you'll take magnesium until you have loose stool, and then you back off on the magnesium until you get at the right dose that doesn't make your stool loose, but allows you to go to the bathroom reasonably well. That's your saturation dose of magnesium during pain. Also, if you do this magnesium loading test, you take an amount that gives you this loose stool, you'll very quickly get the blood levels up, and then you can back down. So for acute pain, you can get them up very quickly in just a few hours. And then fish oil, very important anti-inflammatory and pain modulator. Make sure you use a fish oil that is protein free, because that can cause burping issues with a lot of people experience with fish oil. And what else can I say about fish oil? It helps to thin the blood by reducing inflammation. That improves circulation, which can get out inflammatory mediators and oxygenate tissues and bring nutrition to tissues. So pain is going to, or the injury is going to be treated very well with some omega-3 fatty acids. If you're on any blood thinners, once again, you can't take curcumin. You cannot take fish oil. All right. Next is just 2 more. Proteolytic enzymes. This is like a big secret. Many people just don't know that proteolytic enzymes, pancreatic enzymes, or enzymes from plants like yams, for example. I'm sorry, not yams, papaya. Although I don't think there's enough enzymes in foods to really make a huge difference with people, particularly if they have a chronic pain problem. You're going to want to take supplements of proteolytic enzymes. There are some contraindications for taking them, such as gastric issues, for example, or ulcers. But the thing you need to know about these enzymes is that when you have these inflammatory mediators floating around your body and your circulation, and you take pancreatic enzymes, particularly about 2 hours from food, you will get a heavy load and absorption of enzymes into the bloodstream, and they will auto-digest a lot of these proteinaceous inflammatory mediators. therefore reducing inflammation. So we have these enzymes, which can consist of starch, protein, and fat-digesting enzymes. They break down those inflammatory mediators. They break down immune complexes, and fibrin, which causes thickening of blood and increases swelling and clotting risk. And also, the enzymes help to digest or lower several inflammatory mediators, tumor necrosis factor alpha, for example, a C-reactive protein, and others. And enzymes also improve circulation and tissue repair. So they're going to clear debris, molecular debris that's broken up from the inflammatory degenerative problem, and it'll enhance nutrient delivery to inflamed and damaged tissue areas. And then proteolytic enzymes help the absorption of lots of different nutrients, particularly if you're 50 years old or more, because 60% of people over age 50 do not digest normally. And the last one today is just a reminder of some of the blood detective tests that might complement your efforts to improve pain. One is body composition, because I can use that to help me find out what your protein needs are. And when you're breaking down tissues, your protein needs go up. If you see your lean body mass, that's the protein part of your body's composition diminishing, we know that your proteins have to go up. If you don't do the test, you can't really know if you're losing lean mass or not. And then there's absorption testing. Even the most basic of nutrition should start with a malabsorption test, because if you're going to give food and supplement recommendations to someone, or you're going to take these things, you want to know if you're absorbing them. And then pain type and severity. You want to make sure to keep records, or have your doctor keep careful records of how your whole pain progress is going, so that you can really keep records and show that you're actually getting better over time. Because with long-term pain problems, time gets distorted. It's hard to know what's working. So you want to keep records of things. Are these supplements working? Is the anti-inflammatory diet working? Is the electrical therapy working? Is the acupuncture working? All of that, exercise, etc. And then there's lab markers of inflammatory mediators that you want to see go down with your nutritional and natural efforts, like C-reactive protein and interleukin-6, tumor necrosis factor alpha, and others. So also, one last thought here is that when you consider trying some of these things for inflammation and pain, you might have some other nutritional issues going on that, if you don't know that, what those are, and you try some of these things, they may not work as well. So if you have a fundamentally just horrible diet, and you take all these supplements and do all of these other things, it's likely not going to work, or it won't work nearly as well. So I'd start out with a careful medical health history, find out what all the health concerns are and the health goals. We do some testing. We find out what your chemistry says you need for your needs, which might include some of the things we spoke about, or might include completely different things. So thank you again for joining me today for this brief, but I hope practical discussion of how to modify pain with natural remedies. I'll see you at the next podcast. Thank you.